Type 1 diabetes. What is this disease? Type 1 diabetes is a chronic autoimmune disease that occurs when the body's immune cells mistakenly attack and destroy the insulin-producing cells in the pancreas. Insulin is a hormone that regulates the amount of sugar in the blood. For educational purposes, we will take Sarah's story for example. So, meet Sarah, a 24-year-old graduate student who loves to read and spend time with her friends. One day, she started experiencing unusual symptoms that left her feeling worried and confused. This illness usually develops in childhood or adolescence, although it can occur at any age. As a rule of thumb, type 1 diabetes affects the very young persons, and the type 2 diabetes affects the middle-aged ones. What are the signs, symptoms, and how do they affect Sarah's daily life? Sarah noticed that she was feeling more thirsty and was drinking more water than usual. She also noticed that she was using the bathroom more frequently, even in the middle of the night. She was feeling more fatigued, even after getting a full night's rest. Additionally, she noticed that she was losing weight despite eating more. One day, she began to experience a sudden onset of blurry vision, which was very disorienting for her. She felt like her eyesight was deteriorating rapidly and she struggled to read even large print on a page. Finally, she started experiencing nausea and vomiting and she knew something was wrong. Speaking of symptoms, do you want to know how to discover someone with asthmatic behavior? Click on the pop-up in the right corner. What causes this condition? What causes type 1 diabetes, and how did Sarah end up with it? Her body's immune cells are damaging the organ, pancreas, responsible for the secretion of insulin. This results in a lack of insulin, which is necessary for the body to regulate blood sugar levels. While the exact cause of type 1 diabetes is not known, it is believed to be caused by a combination of genetic and environmental factors. Sarah may have been genetically predisposed to the disease, but it's also possible that a viral infection or other environmental trigger played a role in her developing the condition. Before continuing with the therapy, if you enjoyed this video so far, how about subscribing to the channel to never miss a medical information you like? How can the treatment help Sarah? The primary treatment for type 1 diabetes is the insulin therapy. Sarah's doctor prescribed her with long-acting insulin which she takes once a day to keep her blood sugar levels stable throughout the day. She also takes a rapid-acting insulin before meals to help her body process the carbohydrates in her food. In addition to insulin therapy, Sarah needs to monitor her blood sugar levels regularly, typically 4 to 5 times a day. Sarah had to make some lifestyle changes to manage her condition as well. She had to be mindful of what she ate and drank, as certain foods and beverages could affect her blood sugar levels. She also needed to exercise regularly to help her body process the insulin more effectively. In addition to the insulin therapy, Sarah's doctor also prescribed her with other medications. She takes a medication called metformin, which helps her body use insulin more effectively and also to limit the quantity of insulin required. Unfortunately, there were some complications for the insulin therapy, and the most important one was the hypoglycemia. Hypoglycemia is a state in which the body does not have enough glucose to function properly. Its symptoms include sweating, palpitations, pallor, anxiety, difficulty concentrating. The treatment for this complication was a dose of 15 to 20 grams of glucose orally. Managing type 1 diabetes can be challenging, but with the right treatment and support, it is possible to live a healthy and fulfilling life. Thank you for watching. I hope you like my video. Make sure to subscribe to the channel and press the bell icon to never miss any video in the future. See you next time with another exciting medical video.